I'm Mike Boudreau. I'm the Sheriff of Tulare County. Welcome. I'd like to start off today's press conference with information in regards to a detail that we started at 6 o'clock this morning with 8 other agencies in Tulare County, consisting of us, the Tulare County Sheriff's Office, the Porterville Police Department, Lindsay Police Department, Tulare Police Department, Dinuba Police Department, Exeter, Visalia Police Department, as well as the Tulare County Probation Department. We have 50 officers that started at 6 o'clock this morning, going out to make arrests on already filed cases of domestic violence with the District Attorney's Office. I failed to mention that we are in partnership with the District Attorney's Office in reference to these cases, and warrants were already in place. So that started as of 6 o'clock this morning. This afternoon, we'd like to be able to introduce the fact that we are the recipient of a federal grant that was awarded of $450,000, provided over the course of 3 years, beginning October 1st of this year through September 30th of 2020. The name of the grant is the Department of Justice, Office of Violence Against Women, Improving Criminal Justice Responses. And we'll get into detail with that. The Department of Justice, Office of Violence Against Women is where this generated from, and as an umbrella through the Jenny Geiger Crisis Center. We are one of 2 agencies nationwide who has received this grant. So, together with Family Services of Tulare County, the District Attorney's Office, and Probation, we have formed a domestic violence high-risk team. We are the first in the Western United States to implement a domestic violence high-risk team from the research-based model of Jenny Geiger Crisis Center, which we will go into detail with other speakers that are going to speak today. It's important that we recognize that a collaborative effort, working in partnership with other agencies in an effort to really reduce ongoing risks of domestic violence. The Domestic Violence High-Risk Team uses early identification of high-risk cases through a risk assessment, which we will discuss, engagement of a multidisciplinary team, which we have put together, and ongoing monitoring and containment of high-risk offenders, as well as victim services. I think it's important that we recognize the danger assessment, which is called the DALE, which is a danger assessment for law enforcement. It's a series of multiple questions that law enforcement, as they respond to an issue of domestic violence, will ask very surgical and specific questions in an effort to recognize the potential for future risk to victims. Some of these questions we can provide for you later within our conference, our press conference. The key message is that if it is predictable, it's preventable. Special training and collaboration will reduce near-death or death-related domestic violence incidents and cases that may be escalating towards homicide or high levels of violence can be identified and violence prevented. And that's the hopes of this collaborative effort through this grant. What I'd like to be able to do is introduce a couple more speakers today to help get all the information out to you. So at this time, what I'd like to introduce is our District Attorney, Tim Ward, as one of our partners within this collaboration. Tim?
Thank you, Sheriff. It's my pleasure to be here. I'm District Attorney Tim Ward. Let me say that when I received a phone call quite a while ago from Sheriff about possibly partnering with a program like this, I agreed instantly, and I think that what the Sheriff is talking about, that this is only, we're one of 2 nationwide, speaks to not only our Sheriff's Department, but our community partners as well. And I know we've got Family Services here. I think we would be remiss if we didn't take this opportunity to say, once again, this is an indicator that the partnership, not only in law enforcement that we have, but with our nonprofits and our wonderful community-based groups such as Family Services. We also are in collaboration on an elder abuse program. And we are one of only 8 nationwide recipients for that. So I think it says something to the quality the men and women that not only wear the uniform for the Sheriff's Department, but work in the front lines with our victims every day. So with that, let me say that the trend that the District Attorney's Office was seeing looked hopeful. In last couple of years, we seem to have a downward trend for a lot of crime, including domestic violence, but that trend has apparently changed. Last year, the cases coming into our office increased by about 11%. Thus, the number of filed cases that we are prosecuting daily has gone up as well. We could easily say that that is because of more crime occurring on the streets, and that may be the case. I also think that it is due, in no small part, to increased reporting, and that's what I'm so proud to not only represent the victim advocates that work in our office, but partner with Family Services, because if we can send a message to those families impacted by this crime, that you are not alone, there is hope, and there is someone willing to help if you make the call. And I think that is part of the message today. In 2016, our staff of victim advocates provided service to a little over 1,200 victims of domestic violence. So far, in 2017, we have surpassed that number. I think our number so far in 2017 is 1,320 victims, and that number is probably changing daily. What has always struck me, anytime I tour Family Services, we think of it often as a women's shelter, but what struck me is the number of families and children impacted by this crime. And so let me again take a moment to make sure the community is aware that the District Attorney's Office has programs in place, not only with Fortune, our comfort and therapy dog, to make that process a little less painless. We've also have our Kids Court program. So any family that has a question about the process, if their young one is involved in the legal system, please give our office a call. We're more than willing to share what we can do to, as I said, make that process a little less painful. One of the things that the sheriff has touched on that I think is a remarkable part of this, it's based upon metrics and proven stuff nationwide. Our office currently has 6 domestic violence homicide cases that we are currently prosecuting. When I became district attorney, we put a full-time prosecutor in a position to do nothing but domestic violence cases. Over a couple of years, those numbers went down. Unfortunately, last year and in 2015, 2016, those numbers came back up. So it is my sincere hope that by partnering with this task force and this high-risk team that we can, and I guess the data somewhat supports that nationwide, that we can make a dent in that. So I could not be happier on behalf of the men and women in the office of the district attorney to commit our time, our resources, and our expertise to help in any way we can. And I would not be here without our good Sheriff's Department. Thank you. And Katie Meter, thank you as well. So Sheriff, I'll turn it back over to you.
Appreciate that, Tim. At this time, I would like to introduce Katie Meter. Katie?
Good afternoon. I have mine written. I'm not quite on the fly. My name is Katie Meter. I'm Executive Director at Family Services of Tulare County. We are a private nonprofit organization serving crime victims since 1983. To some, domestic violence may seem like a personal issue. Unfortunately, those of us who work with survivors every day know that it's a serious problem that affects our entire community. So far this year, there have been 11 domestic violence related deaths in Tulare County, including 3 murder-suicides since April. As we stand here today, hundreds of families in our county are affected by domestic violence. In the most severe cases, it's a matter of life and death, not just for the adults involved, but for the children as well. In most domestic violence cases that end in homicide, there are identifiable patterns leading up to the fatal incident. When we can identify early in the process which cases are escalating toward a homicide, there are opportunities for our system to intervene. That's what the domestic violence high-risk team does. It identifies the most dangerous cases as early on as possible and puts in place strategies to intervene for these families. Victims are at highest risk of homicide by a partner when leaving the relationship. The most dangerous time is within the first year of leaving, and more precisely, within the first 3 months. This statistic is counterintuitive. People think that when victims leave that they are safer, but we know what a dangerous time that is, and we have to safety plan for that risk. The Domestic Violence High-Risk Team model focuses a lot of resources on that 3-month window when offenders may be out on bail or awaiting trial. According to the research of Dr. Jacqueline Campbell, who is the leading researcher on intimate partner homicide, the majority of domestic violence homicide victims, offenders, or both, up to 83%, had contact with the criminal justice, victim assistance, or healthcare agencies in the year prior to the homicide. In the year prior to the homicide, more than 44% of abusers are arrested for their behavior, and almost 1/3 of victims have contacted police. At the same time, we know only 4% of domestic violence homicide victims had used a domestic violence hotline or lived in a confidential shelter within the year prior to being killed. This is the key. We are trying to develop innovative ways to reach victims who are not walking through our door for whatever reason, to let them know that help exists because our services are protective. Family Services is proud to stand alongside our partners today to be part of this innovative work. We have many services to offer any victim of domestic violence, including emergency shelter, legal advocacy to help with restraining orders and family law matters, counseling for survivors and their children, case management, and emergency assistance. All services are free. From January through September of this year, we answered 421 calls on our emergency domestic violence hotline. We have sheltered 124 women, 2 men, and 84 children at Karen's house. Total numbers of those sheltered, much like our district attorney talked about their numbers increasing, the total number of those sheltered just through September of this year are up 23% from the total of 2016. We are very hopeful about this new, promising way of reaching the most vulnerable victims in our community. We are excited about the possibility of reducing the number of domestic violence-related deaths and serious assaults in Tulare County. This is life-saving work, and we are very grateful to be a part of it, so thank you.
Thank you, Katie. The important thing here to remember is that we're working together. We want to make sure that our victims are safer. What you see is a new and innovative way of reaching out to potentially the future of reducing any acts of violence. Our deputies, the sheriff's office, in leading this task force, we are going to be the first responder to fill out this sheet. Many very surgical questions that would help lead us to the more violent of the violent. What we're hoping to do is remove that element so that the risk of homicide is removed. That's our effort, that's our goal. But this is a very specific grant. It is not handed out just to anyone. There's very specific details and criteria that must be met. We're thankful to our grant writer who's here today, as well as those that worked in the other agencies that you see before us. But we reached out. We wanted to be an agency that decided, what can we do to truly make a difference? So I'd like to introduce Lieutenant Mark Gist. He oversees this unit within the Sheriff's Office, and he helps spearhead the efforts in receiving this grant. And I'd like him to begin to speak a little bit about what he has done and what our agency has done in an effort to be successful in receiving the funding for this effort. Mark?
Thank you. To begin with, as part of the past grant, the 2014-2017 year grant that we previously had, one of the goals and objectives was to form, implement, plan, and establish the domestic violence high-risk team. Having said that, our partners being Family Services, Tulare County District Attorney's Office, and Tulare County Probation, and of course the Tulare County Sheriff's Office as partners. Family Services and Tulare County Sheriff's Office are both co-lead on this, and we spent many meetings and site visits from the Jeannie Geiger Crisis Center, a lot of phone calls, a lot of policy review and creation, and we had to get everybody, all of our partners, all on the same page with that. So that does take some time, and everyone became pretty passionate about the project because we want it to be successful, much like Sheriff Boudreaux mentioned. Because the bottom line is, even with this, we want to be out there and we want to be the difference. We want to make that difference for the victims of Tulare County, and we want to hold the suspects accountable to the best of our ability in a collaborative effort. With that, we initiated this, or implemented this, I should say, October 1st, 2017. Just prior to the implementation, with part of the planning, we provided, with Jenny Geiger Crisis Center, training to all of our first responders and our detectives within the Sheriff's Office. Additional training was provided to Family Services of Tulare County, Tulare County DA's Office, Prosecution, and Tulare County Probation. With that, on October 1st, the first use of the danger assessment law enforcement form was utilized by our first responders for domestic violence related calls. So far, the use of that form has been beneficial for us as a team to review and analyze cases to come up with planning that's instrumental to help aid the victim and, again, hold the suspect accountable. And that's going to be through ongoing planning, monitoring, counseling, and mentorship to the victim as well as to the suspect. Again, all that works in conjunction to be predictable to help prevent things from escalating to near lethal or lethal type domestic violence incidents. It's on its early stages. So statistic-wise, I believe we've had approximately 19 cases come in for review. Is that right? And again, part of that is a lot of planning to reach out back to the victims if they're not coming forward. We also try to educate the victims, and that starts at the first line, as well as follow through all the way through the investigation, even with Family Services. Family Services even has an additional danger form that I think he hit on that was even up to 20 questions, if I'm not mistaken, a little bit more in depth on the victim side. So we get into a lot of the history versus response, investigate, arrest, and clear. So we get into more of the history with the victim, if they're willing. If not, we advise the victim that they are definitely a candidate for a near lethal or lethal situation should it escalate. And that's based off a research study. That's based off the Dale form that we use out there. That's based off the training that they received prior to implementation of the form itself. Family Services does much the same, and there's many oftentimes that we as a Sheriff's Office or the DA's Office or Probation is not going to know when someone's a victim of domestic violence, because those victims want to try and remain as anonymous as possible and may seek assistance from Family Services and may not want the attention from other allied law enforcement agencies. So it does have its challenges, but together we'll make that difference and be that difference. Thank you.
Thank you, Mark. I think it's important to touch on this morning. We made 17 arrests, 5 of which were women. We don't ever want to portray the fact that domestic violence is solely isolated to the male being the suspect. Women also can be the suspect in these cases. The lieutenant did touch on this, that what we want to do is take that extra step in future incidents of violence. We want to be preventative. We don't want to just be arresting people and putting them into our jail system. What can we do as a community, as a law enforcement group, to reduce those acts of violence? And so that's what we're here to say today. This is a new venture. The data is very raw and it's very new. However, it appears to be very promising. So with that, I'll open it up to questions if you have any. If I can't answer it, I have a great group of people here behind me that can answer it for you. We have our detectives with our domestic violence unit are here with us today. We have many people within the district attorney's office as well as family services and the sheriff's office. So if I don't have the answer, we will definitely find someone behind me that does have the answer. So do you have any questions of us today?
So Sheriff, this is made possible with this very large grant over a 3-year period. Does that mean the program ends at the end of the 3-year period, or it keeps going?
Well, you know, as with any grant and funding source, the potential for that to fade and go away is a risk, but we have dedicated that even if this goes away, we'll continue to work forward with each other to make sure that we're doing everything that we can to reduce those acts of violence and potential for serious injury or death With this grant, I will touch on, we are able to fund 41% of a sheriff's detective. Family Services receives 17% of that funding. The district attorney's office, about 17% of that funding. Probation officer of 25% of that funding. Yes. Okay. One more question, Brian? I didn't think I was going to get away with just one question.
For Lieutenant Gist, if possible.
Sure, yeah, Lieutenant, please.
With the recent visits to since the beginning of the month to some of these victims, what's the impact of telling them the situation they find themselves in and using the words lethal, non-lethal? I mean, those are big, scary words. What have you noticed when in those discussions?
I will tell you that the victims seem to be receptive to getting input from our first responders and even our detectives. And earlier I forgot to mention about our detectives, because that's part of the process also. I can touch on that. It's been receptive, maybe not as much as we would like to see, because we do also need cooperation from our victims out there, and we're trying to help them not be afraid to speak out, to help themselves as well, and that's going to be through education and telling them the truth about the statistics and the research-based things that give us that authority to do so. A lot of them are reaching out. If not, Family Services and or our detective unit will reach out to them and follow up with them to make sure that our services are out there for them and that we care. You know, in totality, I believe that it's in early stages right now, so we don't have quite a measurable tool yet, but those are things that we're closely watching.
Any other questions? Thank you so much for everybody being here, bringing attention to what we're trying to do. I think that the message through the media is incredibly important, that we do care. We want to be there for our victims. We want to make sure that they know that they have resources and that we're taking their lives seriously, as well as to the potential suspects in these cases. That not only are we going to hold you accountable, but at the end of the day, when everything's said and done, hopefully, just hopefully, we can provide you a program that keeps you from reoffending again. So, ladies and gentlemen, thank you for being here. We appreciate your time, and thank you for delivering our message.
Let me, I never want to correct the sheriff, but Katie, I don't believe the Office of the District Attorney receives any funding in this grant cycle. Yeah, we don't right now. The next grant cycle will apply, but in this application, we wanted the funding to go this. In the next funding cycle, we'll be getting a part of that. I just want to clarify that. So.
Yeah, thanks, Tim Ward. Thanks, Tim Ward. So, in essence, round and full circle, I was accurate. You will receive funding at some point. Okay, thank you.